Assalamu alaikum wa rahmatullahi wa barakatuh. Alhamdulillah Rabbil Alameen. We give praises and adoration to Almighty Allah, the uncreated creator. We welcome you all to this Talim, and inshallah, we are going to hand over the program first to Allah with the opening askar from one of our brothers, a member of the askar group, in person of Mr. Oladipupo Jambitu. Bismillah.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم بسم الله الهادي الرحمن الكافي الرحيم الوافي بسم الله الهادي الرحمن الكافي الرحيم الوافي بسم الله الهادي الرحمن الكافي الرحيم الوافي بسم الله الرحمن الرحيم سبحان الله عدد خلقه سبحان الله رضا نفسه سبحان الله زنة عرشه سبحان الله مداد كلماته الحمد لله عدد خلقه الحمد لله رضا نفسه الحمد لله زنة عرشه الحمد لله مداد كلماته الله أكبر عدد خلقه الله أكبر رضا نفسه الله أكبر زنة عرشه الله أكبر مداد كلماته لا إله إلا الله عدد خلقه لا إله إلا الله رضا نفسه لا إله إلا الله زنة عرشه لا إله إلا الله مداد كلماته لا حول ولا قوة إلا بالله عدد خلقه لا حول ولا قوة إلا بالله رضا نفسه لا حول ولا قوة إلا بالله زنة عرشه لا حول ولا قوة إلا بالله مداد كلماته بسم الله الرحمن الرحيم فالق الحب والنوى باسط الأرض وما حوى يا إلهنا وإله الخلائق يا ربنا ورب العجائب يا مولانا ومولى النفائس نسألك السلامة من الرسوب والفوز والنجاة في الأمور سبحان ربك رب العزة عما يصفون وسلام على المرسلين والحمد لله رب العالمين صلوا على النبي الكريم صلى الله عليه وسلم.
Alhamdulillah Rabbil Alamin. Jazakumullahu khairan for that wonderful answer. Now we move to the task for today. Inshallah, I'll quickly read through this. Our task for today will be the short ascar which we have taken. Then the second thing is introduction of the speaker, Ajia Dr. Roheemoh Ewesesan. Isma, can you say salam alaikum to the house?
Wa alaikum assalam wa rahmatullahi wa barakatuh.
You are welcome, ma. Alhamdulillah. Now, the next thing is to take a quick review of what we did the last session. The last session with our topic of discussion still remains health intelligence, exploring effective paths to a healthier life, part 2 for today. The last class, we took the part 1. So inshallah, we quickly go to 3 basic lessons we picked from the last class with her. And these are, number 1, everyone should make conscious effort to get aware of his or her health conditions and be ready to take charge in sustaining a healthy life. Then number 2 is, it is important to desist from drug abuse, self-medication, and visiting polypharmacy. Then the third of which we highlighted was early detection and prompt medical interventions of any health issues saves a lot. May Allah subhanahu wa ta'ala continue to grant us good health. Now, inshallah, on our program for today, we'll be moving to the presentation proper, and we are taking health intelligence, exploring effective paths to a healthier life, part 2. I'll hand over to Dr. Roheemoh Ewesesan. Bismillah, ma.
Now, it's my pleasure to be with us again, continuing on the discussion topic, health intelligence, effective path to a healthier life. From last week, we already have a recap as given by Sister Ajia Sanusi. May Allah bless her for the recap. Today, we'll further explore some of the topics we touched on chronic diseases. And to make it more interesting, last week it was just talk. But today, to make it more interesting, I have tried to introduce some visuals based on the saying that what the mind forgets not, what the eyes see. So before I go deep into some of the chronic diseases that we'll be talking about today, I would like to emphasize on the chronic diseases that I'll be touching on, which are benign and cancerous conditions. When we talk about benign and cancerous conditions, we're talking about tumors generally. I'll also touch on kidney and liver diseases and what risk factors might be implicated. And we'll wrap up with questions and answers. I'll try as much as possible to touch on several aspects and give room for question and answers. What we should have at the back of our mind for today's discussion is, I want us to pick the 2 words after chronic diseases on today's topic focus, which is realities and myths. When we talk about realities, the realities of chronic diseases is that, number 1, it takes a long while before we have manifestation of symptoms. It could take as long as decades, 10 years, 20 years, before you can have the disease fully established and manifesting. And having that at the back of our mind should tell us that whatever treatment option we have for chronic diseases is always long-term. You do not expect to have total cure or remission or whatsoever. Let us have at the back of our mind that chronic diseases have latent stage of manifesting symptoms. It takes a while for the symptoms to come up, and when they come up, it is something that we'll manage for a lifetime. And the management is usually integrated, like involving several aspects of probably specialist care or several aspects of our body of management, depending on the number of body systems or organ systems involved. So the specific chronic diseases that I will be touching on today I'll be touching on age-related and sex-related chronic diseases. That's the benign and cancerous conditions. I'll be touching on cervical cancer. I'll be touching on fibroids, breast cancer. I'll be touching on benign prostatic hyperplasia, which is common in men, and I'll be touching on prostate cancer, which are common in men. And I'll also be touching on some of the causes of these tumors. Some are infectious causes, some are non-infectious causes. And as I explain these conditions, I'll try to link them to the risk factors, which are genetic, behavioral factors, and environmental factors too, that can work together to help progress the disease condition. So before going deep into the conditions, let me just briefly itemize those of these risk factors that we might have mentioned last week. Genetic, there is nothing we can do about genetic. It might run in the family, and we can be like acquired from our parents, or it can be acquired like a lineage acquisition of genes. It would some of these genes responsible for these conditions might just be recessive, might just be lying there, will just be there until something triggers them to behave abnormally, which we call mutation. And once they behave abnormally, then the disease condition begins and then progresses, coupled with a number of insults we might introduce to our body or that might further worsen it, such as unhealthy diets, physical inactivity, tobacco use. We are Muslims, yes. We can say that we do not, some of us don't smoke, some of us don't drink alcohol, which are potential high risk factors for all these conditions. But if we do not smoke, we are exposed to so many pollutants outside. Air pollution is there. Some of us still use kerosene stove, and we use it indoor within our houses, and we inhale all these volatile organic compounds. We inhale them, and all this indoor effects of these inhalations build up into the body system to cause or to wreak havoc. So these are the risk factors that have been proven to be related to some of these conditions that we'll be touching on. So let us start with cervical cancer. So who is at risk for cervical cancer? First and foremost, the fact that you are a woman. Cervical cancer is peculiar to women. Men don't have cervix. So we can say that women are at high risk for cervical cancer. And not all women, but women younger than 50 years of age. Blacks generally. So the fact that we are Africans predisposes us to cervical cancer. So what is the major cause of cervical cancer? Cervical cancer is one of the vaccine preventable diseases. We can prevent it. What is the major cause? The major cause is an infective cause. Infection. It is an infection that triggers it. This is not genetic it does not have any genetic component whatsoever. We have the organism called the human papillomavirus. So how do we get this human papillomavirus? Is it like malaria that when we get a bite that we have it? How do we get it? Several patterns or several avenues have been documented to predispose a woman to acquiring human papillomavirus. And I want us to understand that when we say risk factors, we are not saying categorically that this causes cervical cancer. what we are saying in essence is that it is associated. For some people, it might cause it. For some people, it might not cause it. So if you find a woman with all the risks that I will mention, and she never developed cervical cancer, note at the back of your mind that all these factors are just risk. They've just been associated with having it, but not really causal. What is causal is human papillomaviral infection. You have human papillomaviral infection, there is the highest risk for you to have cervical cancer. So what are the other factors? We have every sexually active woman is at high risk. Early age at coitus, that is, becoming sexually active at a very young age. And why is this an issue? Researchers have suggested that because the cervix is exposed at very early age to sexual activity, there is the increased risk for that cervix to change during puberty. And there are some cells in the cervix that transitions during puberty, which makes that area more vulnerable to cellular transformations. Another factor is multiple sexual partner. Multiple sexual partner is you jump from one, we are Muslims, alhamdulillah, but we need to, we have female children, and we have sisters, we have female relatives. This is an avenue for us to emphasize to them that having multiple sexual partner is a high risk for you contracting the virus, because you never can tell who has this, and who you have acquired it from. Smoking is a risk factor. Parity, studies have shown that as many times as much as a woman gives birth, a risk of having cervical cancer increases. Why? Because as the cervix undergoes birth, the child comes out from that cervical canal, the cells around the mouth of the cervix undergoes transition. Another evidence has shown that having a child earlier than 20 years increases the risk. Sexually transmitted infection, chlamydia, human immunodeficiency virus, herpes simplex virus, have all been shown to increase the chances of having cervical cancer. Another thing is oral contraceptives. Most of our mothers use oral contraceptives. I must say this, that a lot of us will entertain that fear that, this is really a huge issue, but we should understand that there is a caveat when it comes to oral contraceptive use. That is, if the use is continuous for greater than 5 years, that is when the risk is increased. But once the drug is discontinued for as much as 10 years duration, then the risk suppresses. If you have a family history, there is a higher risk of you having cervical cancer. Immunosuppression, poor nutrition, diet low in fruits and veggies, these are all risk factors. Okay, a prop-up just came down that I should try to code mix. Okay, I'll try to introduce Yoruba so that a lot of us will understand what I'm saying. So what are the symptoms that we see? Kini, àwọn ṣàkíyèsí for people that have cervical cancer. The symptoms that you will see is abnormal vaginal discharge. An abnormal vaginal discharge or bleeding after sex for women still in their reproductive age, who are still sexually active. For women in their menopause, when they see abnormal vaginal bleeding, then it is a sign for something abnormal and can be traceable to cervical cancer. When you see abnormal vaginal bleeding in between menses, when other conditions might have been ruled out, then it might likely be cervical cancer. If you are experiencing pain during intercourse, pain in the pelvic area, that is the lower area of your abdomen, unusual discharge that might be kind of stained with blood, these are signs, or these are symptoms that most patients with cervical cancer present with. Someone is raising a hand, but I think it would be nice if we try to leave questions till the end of the discussion, so as to be able to touch a number of things and give we don't digress too much. I hope that I hope the person raising the hand is not offended. So cervical cancer, like I said, is preventable. We can that is, it is something we can prevent. And how can we prevent it? It is by vaccination. There is this vaccine we can get that can reduce our risk of of developing cervical cancer. We need to be careful when it comes to vaccination. Vaccination is good, but we should be aware that vaccination does not 100% prevent us from acquiring cervical cancer. Why is this so? This is because there are several serotypes of this human papilloma virus, and what we get, the vaccine we get, is that one that is targeted towards the high risk, the most potent of the virus that causes the cancer. So when most of the time you can be vaccinated, and if you at any point in time in life acquired human papilloma virus that is sensitive, that the vaccine the vaccine you've gotten that had built your immunity against that virus, if you are able to contract the vaccine, the immunity you have built in yourself, the vaccine works to actually counter the effects of the viral invasion in your body. Peradventure, for some people that might be vaccinated and still come down with cervical cancer, these people might say, well, I got vaccinated and well, I think it doesn't work. This is why I need to disabuse of our mind of that belief, because there are several serotypes of human papilloma virus that can cause cervical cancer. And so vaccination is only given against the most high risk virus, not all, that do not cover for all strains of virus. Regardless, it is still advised that we get vaccinated. At what age should we start vaccinating? We can vaccinate our children, because most of the time when I hear lectures about cervical cancer, we only focus on women, sexually active women. But this is the time that we need to be informed that our female children need to be vaccinated early enough in life. As a female child or male children can be vaccinated as early as 9 years, or the standard is to start vaccinating them at 11 or 12 years. We can get this vaccine through the age of 26 years. But studies have shown that getting the vaccine after 26 years might not really be effective and might not really be preventive. But for women over 26 years that are not opportune to receive this vaccine, what should they do? If you find yourself to be at high risk, that is, you are sexually active, you started in a sexual intercourse at a very early age, your first child, you had your first child before 20 years, you've had history of sexually transmitted diseases before, you've been on oral contraceptive use, family history, and if you think all these things makes you fall at an high risk, then you need to go for cervical screening test. And how is cervical screening done? It is just a pap smear that you do. If everything is done and they find out that the cells in the cervix are still normal, then they will schedule you for 3 yearly intervention. So that said, I'd like to share this screen with us just to give us a fair idea of what I'm trying to explain. I don't know if my screen is visible.
Not at the moment, Ma. You need to click share screen on your computer.
Yeah, I've done that.
We can't see your screen.
Is that visible?
Yeah, okay, now you're sharing. Now you're sharing.
Okay, so this is what I'm talking about. This is,
you need to double click because it's showing just a blank image.
well,
Exactly, this is it. This is fine.
okay.
Yes, it's gone. We have your computer screen now anyway, but okay, yes, we have it now.
Okay, so this is what the cervix, looks like. This is the uterus, and the part of it that you have this is, sorry. So the mouth of the uterus is what we call the cervix. And we can see this is the healthy cervix. This is what the cervix looks like. But once the cervix has abnormal issues with it, once there is a cancer, this is what we see. The center of it becomes abnormal. And this is the progression. From the center of the cervix, the cancerous cells grow, multiply, and then they continue to grow and spread. You can see they spread, and not only do they spread to the uterus is inside the abdomen, is in the pelvic area, and this cancerous cells spread to several organs that surround this uterus, and that is where other complications comes in. I wouldn't want to dwell into the complications that comes with this, but this is something we need to understand. So let us go back to sorry about this. Okay. So back to the discussion.
Do you want to take off the image?
What?
You want to take away the image?
Yeah, I'm trying to stop the share so that you can.
Here for you, if you don't mind.
Okay, yeah. So I think I've stopped the share.
Yes, it's on now.
Okay, yeah. So we'll now move on to the to men. I said earlier on that we have age and sex specific chronic diseases. We've touched on cervical cancer for women, and then now we'll be touching on benign prostatic hyperplasia for men. I think I shouldn't have exited this because I have stuff that I want to talk about for men. So I apologize for this. I hope we'll be able to meet up with the time with this back and forth.
Okay. Do you want the screen?
Okay. I'm sorry, I apologize for that. Okay, let us just continue. So for the benign prostatic hyperplasia, I'll keep talking and then see if I can share anything with us. So for the benign prostatic hyperplasia, this is a benign condition. It is not malignant, but it is just benign, and it is usually seen in men. So what does the prostate looks like? The prostate looks like the size of a walnut. Walnut, asala. I'm very sure that the majority of us will really can understand what asala is like. And the prostate sits just below the bladder. So by sitting just below the bladder, it is expected that whatever happens to the prostate affects the bladder and affects every other structure that surrounds that area. So what is the function of the prostate? The function of the prostate is for it to secrete fluid to nourish the sperm for transport through the urethra. So what are the risk factors for someone developing prostate cancer? The risk factor is aging. Generally, men in their 30s undergo some changes in their prostates. But benign prostatic hyperplasia is not actually seen, is not actually symptomatic in men in their middle ages until probably the 6th or 9th decade of life. But autopsy studies have shown that even men in their 40s, 8% of men in their 40s have been shown to develop prostatic hyperplasia. So what are the other conditions, other risk factors for developing benign prostatic hyperplasia? It could be genetics and it could be geography. So what are the modifiable risk factors? That is, this benign prostatic hyperplasia. Hormones generally, the testosterone level in men is what actually increases their sexual drive and responsible for so many masculinity in men. But as men age, the testosterone level drops and estrogen increases. So once this happens, there is increased proliferation of cell tissue in the prostate, and this increases the size. So what other factors have been implicated? Obesity, being big, or having a very high weight, BMI greater than 35 kilogram per meter square. So diabetes are risk factors. Diet, you can see that from last week and today, majority of the conditions that we'll be speaking about, we have some elements of diet implicated. Red meat, fat, milk and milk products. All this food lacking vitamins, food lacking vegetables, all these things contribute to someone having prostatic hyperplasia. Physical inactivity and inflammation. So these are modifiable risk. I think it would be better for me to actually finish on this discussion, and then we'll go back to the pictorials so that we don't be doing so much back and forth. So, kina won nkan tí àwọn ọkùnrin máa ń rí as symptoms that can actually send a signal that this is what we are dealing with. Number one, there can be hesitancy. When a man starts complaining like, tí n bá fẹ́ tọ̀, ìtọ̀ yẹn ìtọ̀ máa gbọ̀n mí, but mi nílé ìsétọ̀ máa wà, mi nílé tọ̀ ìtọ̀ yẹn jáde dáadáa. Then when a man starts complaining about weak stream, like tí n bá fẹ́ tọ̀, normally when men urinate, their stream is always projectile. Bó ṣe kọ́ wa ní med school ni pé wọ́n ní tá bá rí àwọn ọmọ kéékèèké tó bá dúró tó bá ń tọ̀, bọ́n ṣe máa ń ṣeré, wọ́n ní ẹ jẹ́ kájọ wo ibi tí ìtọ̀ oníkálukú máa fly dé. That is how they describe stream of urine. If the stream of urine is not projectile, like the force only for like a C or U, then there is something wrong with the stream. Tó bá ti ń di pé ọkùnrin ń tọ̀, ìtọ̀ yẹn wọ́n tọ̀ bá ara, the stream is not projectile, then there's a problem. Incomplete voiding. What is incomplete voiding? You feel that you have finished urinating, yet you still feel that sense that nǹkankan ṣì kù náà nínú ilé ìtọ̀ yẹn, ìtọ̀ yẹn ò jáde tán. Terminal dribbling. What is terminal dribbling? Some men will complain that I want it tán, but àwọn ṣì ń feel pé they cannot, there's this involuntary release of urine. The urine will still be coming out. Then nocturia, they wake up several times at night to urinate. Though there are some other conditions that can cause nocturia, like diabetes. Those people that have diabetes complain severally. They complain that they wake up severally at night to pass urine. And urgency. Like they will not be able to, if anyone has the symptoms of BPH, they will not be able to control how much they can hold that urine. They will not be able to control it. That the urgency and the frequency, they will not be able to control it. Number one, the urine will be just becoming in bits, and the frequency will be increased. So what is protective of what can you do that lifestyle changes that you think can actually help you or reduce the risk of you developing BPH early in life. Increase your fruit intake, your vegetable intake, reduce your saturated fat intake, butter, several foods loaded with cholesterol, reduce it. Take omega-3 fatty acid, foods rich in linoleic acid, vitamin A, vitamin D, antioxidants generally, vitamin E, lycopene. Tomato has been proven. Tomato contains it. It's very rich in lycopene. So it is encouraged that men eat tomatoes a lot. I'm sure it will be absurd. But there are several ways that we can use tomatoes in our food, like using it to garnish food, and it would help us. It will be beneficial to us. Carotene, we can see that in carrots and any food with red pigments generally. So that's for benign prostatic hyperplasia. The sister or the elder sister to benign prostatic hyperplasia is the prostate cancer. So the prostate cancer is the cancerous or the ones I've been talking about, cervical cancer, benign prostatic hyperplasia. Cervical cancer is cancerous. It's malignant. But benign prostatic hyperplasia is benign. It is life-threatening though, because it affects daily life function. But it does not actually cause dysfunction in other parts of the body. But when we talk about prostatic cancer is like cancer that can spread to other parts of the body. And what has been proven to be risk factor for prostatic cancer is age, advanced age like we've mentioned, race, being Black, and family history. So if we have anybody that peradventure we've been told that babani prostate cancer Rio, then definitely it should keep us on our toes. So always go for screening check to be able to identify this at an earlier stage in men. Here, when you go for screening, they'll tell you to do prostate-specific antigen, all this series of tests, and then you can be on top of it just to be sure that you don't get it's diagnosed early or it's picked up early. So another thing chronic disease we'll touch on is breast cancer for women. So by virtue of being female, we are at high risk. But this is not to rule out the fact that men too can have breast cancer. But the percentage is really, really insignificant, like maybe 1 in 100,000. Early menarche, those who started their menses early in life before the age of 12. Late menopause, those who still menstruate after the age of 55 years. Why is this so? The reason is that estrogen is responsible for breast cancer development. And if you start menstruating at an early age or late menopause, it means that your body is still producing estrogen. Your body is exposed to estrogen, and several organs in the body that are estrogen receptor sensitive will always feed on this estrogen and cause proliferation. Although the major cause in only cell mutation, gene mutation. There is this gene, BRCA1, BRCA2, that actually is the risk factor. So if you have a family history of breast cancer, not family history alone, but first degree relative, either your mother, either your sister, or a daughter, or a male family relative with a history of breast cancer, then it is mandatory on us that we be on top of it and do serial screening checks to pick up the diagnosis in us early enough, or to prevent us from having advanced cases of breast cancer, picking up advanced cases of breast cancer later in life. So I think I've touched on the non-modifiable risk factors. But for modifiable risk factors, what other things that these are things that we can control? The other things that we've mentioned are some things out of our control. But what other factors are within our control? Overweight. Being big is a major problem and is the major cause of most of the chronic diseases we have. Obesity is becoming an epidemic, and it's the major predisposing factor to most of these chronic diseases. Diet, we always keep mentioning it. Physical inactivity, ionizing radiation. If you've been exposed to X-ray in the past and you have a predisposing factor, family history and all that we mentioned in the past. We do not take alcohol, so I might not really touch more on this, but it is good for us to know that alcohol increases your risk. This is because alcohol reduces the liver's ability to control levels of estrogen in the body. Smoking is also another risk factor. Smoking is implicated in so many of the chronic diseases that we have. If we say we do not smoke, remember that we get exposed to indoor volatile organic compounds that can increase our risk. Exogenous estrogens, oral contraceptive pills. That is why some women, when they request for contraception, they try to ask them histories about their family. If they find out that you have family history, they might not recommend it to you. That was why I said last week that let us try as much as possible to know so much about our family history and be transparent, be truthful enough to our caregiver so that we do not complicate matters for ourselves. So what is protective? What is protective of breast cancer? Breastfeeding and pregnancy. Allah has enjoined us. Breastfeeding is even in the Quran. Breastfeed your children for 2 years. I don't know why some of our mothers fail to really adhere to this practice, because it is very helpful and it has been scientifically proven that it helps to reduce the risk of developing breast cancer at early stages. So another thing that I will touch on briefly is fibroid. All the risk factors for breast cancer that we've mentioned are risk factor for fibroid, except the genetic factor. But the myth about fibroid is that some people still believe that if they take herbal medication, fibroid will mayo. Some people believe that be fibroid. I will show us pictures that would tell you reason why these things are possible. But note that fibroids, number one, they be. And fibroids, the myths about fibroids too is, some people believe fibroids reduces fertility. Yes, it does. And to an extent, it does not actually cause infertility depending on the position of the fibroid. So lastly, I will dwell on alternative therapies, which are the important causes of liver and chronic diseases most recently diagnosed. So the pros of alternative therapy is that, well, some of these therapies have been proven to be good for maybe chronic disease treatments. For instance, garlic, well, it's been proven to lower cholesterol. Ginkgo, it's been proven to lower cumin powder, all these seasoning powders. Green tea in low doses for those that are using green tea to slim or burn down fat. All these things have been proven to be effective in low doses. But how do you know which quantity you've used that is in low dose or in high dose is the problem? So let us be extra careful when it comes to using all these alternative therapies for chronic disease management. Scientifically, those are the pros. Scientifically, the con is that most of all these alternative therapies or the herbs we use do so much harm to our liver and the kidneys than good, especially green tea when taken in very high doses. All these ginseng products that are flying about some years back, and Chinese herbs, all these stuffs, they do more harm to the liver and the kidneys than good. So we should try as much as possible to avoid them. For us in the tropics, in Nigeria, for instance, we have, we use agbo. We just cut leaves and then cook them, and we use that as alternative to conventional drugs. It is not to say that these are not good, but like I said, it does more harm than good. Why? Because industrialization pollution, as actually our soil environment is polluted with heavy chemicals. In fact, a study conducted in Nigeria by Awodele et al. In one local government in Edo State, they tried to extract some leaves and herbal roots and then quantify the heavy metals that they can get from all these plant products. And they discovered that the majority of people living in that area, or those that are presented to hospitals living in that area with chronic liver conditions or kidney conditions, can be traceable to the fact that they've taken herbs that they've used, they've acquired from all these contaminated environments. So we need to be very, very careful about what we take or put in our mouths. So the take home for today is that we should understand that chronic diseases, they have latent period. They do not just start. If you have any symptom today, note that it's been happening for years. It just starts manifesting. Be sure that you trace and know your family history. Because once you have any complication, it cannot be reversed. It can only be managed symptomatically. Let us always learn to live responsibly. And the key to good health, for us to be able to live responsibly, is for us to be disciplined. For us to be disciplined, take to advice and seek help. Not seeking help, seek appropriate help when necessary. I think with that, I would like to stop because I was told I had just 10 minutes. But while I'm trying to entertain questions, I'll try to share the pictorials and give some explanations based on the slides.
Alhamdulillah Rabbil Alamin. Jazakumullah khairan for that comprehensive explanation. We really have picked a whole lot from the discussion. Jazakumullah khairan. May Allah increase you in knowledge. From the discussion so far, we have been able to jot down from what our doctor has said. She has itemized chronic diseases that are related to women and also chronic diseases that are related to men. And she has been able to actually emphasize that it is very critical that we all know our family, we should have our family history. Maybe we should learn to know what persists or the particular disease or infection that could be a family lineage that can be inherited from the family. She identified the cervical cancer for female and also the breast cancer and fibroid as diseases that are things that we can easily get due to aging, or probably we inherit some in family lineage. And to the men, she also spoke on the prostate cancer. We pray Allah subhanahu wa ta'ala continue to preserve us all and guide us from these deadly and chronic diseases. Amen. Now we are going to be taking questions. I want us to send in our questions through the chat box, or we give room for people to also raise their hands so that we can get you unmuted and take your question. We'll be doing this within 5 to 7 minutes so that we can we have about few minutes left to the end of the program. So questions. Hello.
Okay, so while we wait for questions, yes. So let me just I'm not sure if you can get my screen now.
Yes, we can, ma.
Okay, so the slide we have on the screen is the for the men, the BPH, which is the benign prostatic hyperplasia. So if we look at the first picture, this is the picture of the normal bladder. The big ball, the big balloon is the bladder, and what is down under it, where my cursor is the prostate. This is the prostate, and this where the arrow navigates through, that is the urethra, through which it passes urine or seminal fluid. So this is the normal anatomy. So when we have abnormal anatomy, when the prostate is big, this is what we see. We can see that once the prostate is big, there is occlusion of where urine passes. This other space is where semen passes through. So once there is occlusion to passage of urine, there is backlog of urine, there is urine collection in the bladder, and there is irritation. So that gives rise to the symptoms that men observe, like the frequency, the urgency, hesitancy, and all the symptoms that they see. So what they do is, once the men identify issues like this, they see their caregiver, and then they give them drugs to shrink this prostate so that they can live a functional life. Because if this is not done, the backlog of urine, it might compress on the kidneys, because the kidneys are very close to the structures, some structures in the abdomen, and backlog of urine can affect kidney function. So concerning fibroids, this is what I'm talking about. In this is the uterus. Uterus walele iliomori. You can see iliomoni, this funnel-shaped stuff, and all these masses, all this something that looks like balloon. These are fibroids. So tabalo visit alagbo, Thomas of be fibroid. If you look at this thing, this is pedunculated fibroid, the one within this uterus. I'm not sure if you can see my cursor where it is pointing at. So what happens with this is that you can see this mass.
Yes,
that is hanging. This that is hanging here on this small pedicle. So this pedicle can twist, like twisting and cut off. So if this big ball cuts off, automatically it will fall through the uterus. Fibroid. Nothing of such happens. It is just that the normal anatomy of the fibroid permits it to fall at that particular time. I guess that is understood. So this is another scenario. This is also a uterus. These globules, these big stuffs are fibroids. So this kind of fibroid does not prevent a woman from getting pregnant. It does not affect anything. A woman with fibroid, you can see someone with big belly, up and down like that. The doctors have diagnosed that she has fibroid. Yes, she will conceive and have babies. But the only issue is if the fibroid is encroaching, as the baby grows big, the inside of the uterus expands. So for some of these fibroids that are outside, if they try to compress on the baby, it can cause issues for the baby, maybe small size, or the baby might not grow properly, but it doesn't actually totally affect giving birth. So this is to touch on agbo and all other chemical insults that we self-administer or self-use. This is the aftermath. This is what it can cause. I'm sure that when we go to the market, some of us buy liver. And if you want to buy liver, which is edo, tabafera edo, we look for the fresh edo. So no one will ever go to the market and see edo toro, this second edo, and be willing to purchase it. So if we really know what harm we do to our body with all these stuffs we put inside our body systems, we'll be careful and we'll have a rethink with whatever we consume or what we take without medical guidance. So this is the normal liver and this is the abnormal liver. I guess with these pictures, we will have a rethink today and we'll do things the right way. So for kidney diseases, generally that I touched on, the effect on the kidney is massive because the heart pumps blood to the kidney and the kidney pumps blood to several organs in the body. So once the kidney function is affected, the kidney is not able to excrete. Kidney here only toxins, so this thing builds up in the body, and what it does is that it affects brain function, and then you have what we call neuroencephalopathy. You have heart problems. It affects the lungs too, like any come down with breathing issues. It affects the liver. It affects the intestine with toxin. It affects the whole immune system. So we should be careful about insulting our body as it affects kidney functions generally. So I guess those are the slides I want to share with us, and I'm still awaiting questions. Okay.
Okay, there are some. We have, yeah. The ES is also ready to ask a question. And we have
Okay.
another question I have sent to you.
Okay, so
Hello.
I can see this question. If an individual have a family history of cervical cancer and prostate cancer, how best do such person prevent similar conditions? Okay, if you have a family history, what is most important is that know that you are high risk. If you've passed the age of getting vaccine more than 26 years, then all you can be advised to do is regular screening. You screen, you do a pap smear, and once they establish that the cells in the cervix are still normal, there are no precancerous cells, they will tell you, come back after 3 years. But if there is anything abnormal, they will book you for necessary management procedure. So for prostate cancer, the prostate cancer is somehow, it could be palliative, it could be radical. It depends on the stage. Prostatic cancer, it depends on stage. And if you have any in the family, Tomatin present with symptoms that it is not something we should just take with levity. We should try as much as possible to be involved and manage them appropriately. And for us too, it is the time for us to always go for screening. You go to the doctor, they conduct tests for you, they check your prostate specific antigen. There's a particular level the PSA should be at. If it's way above that level, then definitely to signal something is abnormal. And there are some other tests too. They can do digital rectal examination for you to as they probe their hands deep and see, they can feel if the prostate is actually enlarged. So with that, coupled with if there are symptoms, your caregiver will talk to you, and then they will establish some line of care for you. That's for the question. That's
Okay.
I can see colorectal cancer, not cervical cancer. So colorectal cancer is another thing entirely, though not really common amongst blacks, it's common among the Caucasians, but it is something that we need to dwell about, because most of the cause is actually due to the dietary intake and some other genetic predispositions too. So we need, unfortunately, we really don't have time to dwell on this issue, but colorectal cancer is really something worthwhile. The symptoms that people with colorectal cancer can present with is, some of them can present with blood in their stool. Ẹlòmíì, ẹ jẹ́ kí n ṣàlàyé bó ṣe máa ń kọ́kọ́ bẹ̀rẹ̀ lélẹ̀, ẹni yẹn ó máa yàgbẹ́, ẹ mọ̀ bí ìgbẹ́ ẹran ṣe máa ń rí, tó máa dúdú, tó máa ṣe róbóróbóróbó, tó máa rí kúlúkúlú yẹn. That is the classical presentation of people with colorectal cancer. So once we see situations like this, let us try as much as possible to alert our caregivers. Or if we have family members with history of things like this, then it is mandatory upon us to schedule serial checks.
Okay. All right, Ma. I think we got a whole lot to learn from that. Now we have another question. If one is hepatitis B positive, what should one do? What can be done if detected to be hepatitis B positive?
Yeah. So concerning hepatitis B positivity, it is vaccine preventable. There are vaccines for it. But well, it might happen that you might contract it. It is highly, highly infectious. Very, very infectious. And it's been implicated as one of the viruses that can damage our liver, that can tilt us to having chronic liver disease or liver cirrhosis. So once that is established, you cannot diagnose hepatitis B infection yourself. Your caregiver will definitely diagnose it, and they can place you on medications to actually suppress the viral load.
Okay. All right, ma'am. Another question we have here is, how does late marriage or delayed conception or pregnancy affect fibroid? Did you get that, ma'am?
Yes.
Okay.
I mentioned earlier that breast cancer and fibroids, most of all the risk factor for fibroids, for breast cancer cause fibroids. And what is the actual risk is continuous estrogen exposure. We have an hormone in the body that makes us female, estrogen. So if your body is continuously exposed to estrogen, then definitely, and it's not alternated by some other hormones. I said, I mentioned protective factor for breast cancer initially as pregnancy and breastfeeding. Why is this so? It is because the normal physiology of the body is such that when you are pregnant, progesterone is an hormone that stabilizes the body. So this hormone it counteracts the effect of estrogen. It balances it, and you know it helps to suppress estrogen function at that particular time. So breast cancers, proliferation of cells with estrogen receptor positive tumors is suppressed. The same thing works for fibroid. If it's in a fertile land, the uterus is fertile, there's nothing in it, and there is no hormone to actually counterbalance the effect of estrogen. Definitely, if there is any tumor in that place, estrogen will continue to act on that tumor to help it grow. The thing will just be building blood vessels and the other mama, oh mama B, oh mama to BC, oh mama to BC. So not having a child at all can predispose to, can make you have fibroids that can cause infertility. But I mentioned before that for some people, it depends on the location of the fibroid. Some people have massive fibroid. If it does not have anything to do with the interior of the uterus, they are fine, they can conceive, and it wouldn't affect their fertility. But if the fibroid is somewhere along the tubes through which the eggs goes into the womb for implantation, then there's going to be a problem. I hope that answers the question.
Yes, ma'am. Then I think we have another question here. Someone will want you to shed more light on and talk more on the effects of canned food. Hello?
Yes, I'm listening.
On the effect of canned meals, as in, and the non-natural food substances on health issues. And what are the impact of canned foods and non-natural food substances on health issues?
So, what we should understand is processed foods generally, they are not natural. For something, okay, let instance, have you ever cooked food and kept it in your refrigerator? Even for some people that live in developed worlds, and they keep food in the refrigerator for more than 2 weeks and it will not go bad. In as much as it is not in the freezer, which is regulated at 4 degrees Celsius, if it is still somewhere above that temperature, it will still get bad. The same thing with processed food. Processed foods are processed. It is not natural because they have to put several chemicals together as preservatives to keep the shelf life. So all these chemicals put together, they are fine. They can pass FDA, can food regulation authorities can pass it that, well, you can take this thing. But if we have to consider the health implication of some of the preservatives and some of the things they use to preserve the shelf life, then it should help us rethink that processed foods are harmful to the body, and they've been linked to a lot of cancerous conditions that are reported cases of cancerous conditions that we have on the increase.
Okay. Another question we have here, Ma, is someone is talking about the she's asking, I think I sent you the private chat. I lost my network just now trying to fix it.
So
I sent you on private chat.
Okay, I can see the question. What best practice can be given to reduce abdominal cord? You know, it what pains in babies. It's quite, I'm sorry I have to do this, but I need to reassure us, in medicine, there is nothing like, you know what? what it is called is colics. And there is practically nothing we can do to reduce it. That's the truth. If you go to any doctor and they give you gripe water, they give you all this water that you should use you should give your baby to reduce the symptoms of the pains. They are just giving you placebo. It doesn't have any, all these things they give you does not have any effects. Colics are normal for babies, and it is expected that within 3 months it wanes off. So these are normal things. It might be frustrating for mothers to see their babies have discomfort, wriggle, cry, and show all sorts of things that make us feel worried about them. But these are just natural things, natural expectations for new moms. That, well, nothing can be done to this. It will run its course and it will go.
Okay. Another question we have here, ma, is, please, is iCettle the same as prostate cancer? Hello?
No.
Okay. Is
I don't know what this means.
Means by iCettle. All right.
I don't.
Okay,
is
I
that
what
kind of language is that? I'm not sure.
It's not a medical language.
Exactly.
Okay, let's take the next question. A child with PILE. PILE treatment, as in last PILE, what is the treatment? What possible treatment can you advise? A child with PILE.
Okay, so for children with PILE, one idiomo yen yo. So kilo le fa ki idiomo ma yo. There are several things that can cause that. We need to establish whether this child usually have difficulty in passing stool. Like the frequency of going to the toilet, we have to establish that. Shomo man lo toilet regularly. She cocaine, constipation. Yes, that's the word I'm trying to look for. Constipation is a major risk factor for kidiomomayo. So in children like this, we try to watch out the food they eat. Feed them with lots of vegetables, fruits, fluids. So that's kind of, soften their stool. So if we are able to eliminate dietary causes of constipation, then we can manage the symptom itself. There are surgical sclerosant where they can give cream to rub to that area and the thing will shrink. Their was strained to an extent. It might require surgical procedure that they can, do some banding and all sorts of surgical procedure. But usually, if someone complain of notice constipation in one more, strain. It's like you're straining to only some other chronic conditions. For sort of like a protracted case of coughing that can increase the intra-abdominal pressure. So with that, it pushes some of the organs from the abdomen down. The pressure pushes down on the intestine, and things like that can actually cause kidiomoyo or no. So that we identify some modifiable risk, and if it is beyond that, then we go to surgery. Okay, I think I get the Yoruba for the prostate cancer now. Iseto, fantastic. That is the word to call it. Iseto. Wow, in fact, I want to learn Yoruba from some people. Iseto gogono manque. Iseto ni. Ito yama wa sheke mama lo frequently. Things like that I've mentioned earlier. Kito majade ton, exactly. That is, it can be BPH, the benign condition, where the prostate is just that is sitting, push is okay, push the bladder is okay. So by pushing the bladder, then it accumulates in ileto. So èyí tó yẹ kí wọ́n fi tọ̀ tán yẹn, nítorí pé ojú ibi tó yẹ kí tọ̀ yẹn ti gbà jáde ó ti narrow, ìtọ̀ yẹn ó máa dúró síbẹ̀, á kàn máa wá díẹ̀ tẹ́rẹ́ ló máa wá.
Okay.
So if we have situation like that, we need to see our doctor. They will give us drugs to shrink that prostate, and if there is anything else they can do, if the drugs are not working, then they can do prostatectomy. They can take it out.
Okay. Thank you so much, ma. Then we have one hand up here. I think either Miss or Mr. Daramola. Please, can you ask your question? Hello.
No. I wanted to make the correct pronunciation of that Iseto, that's why.
Okay,
yeah, sorry about that.
Iseto, that's the word to use.
All right, thank you so much, sir.
Well done,
all right,
well done.
Okay. Now, from one of our participants, we have another question. Please, can our doctor find time to discuss cerebral palsy, as we don't want our sisters to have experience of this? As it's a terrible experience.
Inshallah. CP is a very broad area that I don't think we can discuss in 5 minutes, but I can just touch on it just for us to have an idea of what it is like. Usually, when cerebral palsy happens, cerebral palsy is like a neurological impairment in a child, and it happens at birth or peripartum, during birth. So when it happens, it's not usually the fault of the mothers or the sisters. And to an extent, so many things can happen at the time of a child being born. Usually what happens in cerebral palsy is it is caused by hypoxia, like a transient deficiency in oxygen delivery to the brain. And once there is that transient loss of oxygen delivery, that part of the brain dies, and the child can come down with this neurological manifestation. So how does that transient hypoxia happens? At that point, so they want to establish that the baby is breathing. The baby is actually taking in oxygen to really the lungs takes in oxygen to feed several parts of the body, especially the brain. So it is usually not the fault of the mother at some point in time. It is actually events that surrounds the birth of the child that is actually the cause.
Okay. Alhamdulillah Rabbil Alamin.
Can I ask my question?
Okay. So there is this question: what sort of medical teaching?
I think hello.
No.
Okay, I'll take this last question, and we move over to the next program. Someone is asking here, why are some of these chronic diseases described to ascribed to blacks alone, not whites? Is it as a result of location of the skin? Did you get that, ma'am?
Yes, not necessarily. We cannot categorically say that it is attributable to skin color, but from research, what has been done, some diseases are common amongst the whites, some are common amongst the blacks. It is not skin related. For instance, breast cancer. Breast cancer is common amongst the blacks. Fibroid is common among the black. It is what research has proven. Prostate cancer, BPH, studies have shown that it is common amongst the whites. Why? Because they screen a lot for these things. Here, we hardly do research. We really do not have that data source or that accurate data source to tell us that this is what the situation is. Because our people is either they do not report, or they report late, or we don't even have database that records this information. Most of the time when we go to our hospitals, we give them our information. When you go there 5 years from now, your information is nowhere to be found. You have to give them that information again. So the fact that we do not have appropriate or good data recording system leaves us at a disadvantage for us to actually know what the true picture of these issues are. So it is not about some are peculiar to white or some are peculiar to blacks. It is just what research has proven over time.
Okay, all right, ma'am. Then the very last question I got on the slide, on the chat box again, is what sort of medical teachings or hygienic practices can we be introducing to our children as they grow?
Okay, so this does not only apply to our children. It applies to us. Let these children learn from us. If we are the kind of parents that we encourage them to feed on junks, they do not see us, practice what is right concerning our health. We do not engage in physical activity. We don't see anything wrong in taking sugar sweetened beverages. We really do not care so much. They too will see it as a norm in their life. They will see it as a norm, and they will grow with all these bad behavioral habits. But once we start and we model and they see in us that, oh, this is what my parents do, and these are the lessons my parents teach me, that, whoa, if I do this, these are the benefits. Then I think with that, we'll be able to grow children that will be health conscious and will really, engage in good hygiene practices and live a healthy life as they transition from childhood to adulthood. I hope that answers that question.
No. Alhamdulillah Rabbil Alameen. I think that's the last question we have for this segment for today, inshallah. Now, on our agenda, before we move to our ES is to give us the closing remark and the closing prayer. ES, please, are you with us? Hello? Okay, while we await that, I want to use this medium to say Jazakumullahu khairan to Dr. Ewesesan for the wonderful presentations. The question and answer segment was wonderful. We were able to pick a whole lot from it. We need to actually work on ourselves, then as well take the kids along in whatever we are doing. May we pray Allah subhanahu wa ta'ala continue to protect us all from all these chronic diseases. Amen. Now, is the ES with us now? We await your remarks and then closing prayer. Hello, Assalamu alaikum, sir. Assalamu alaikum. Hello. All right. I think the ES is currently not available. Hello, can you hear me?
Umubora, I think the ES is offline.
Okay.
I think ES is offline. And I also have a final question which I've sent to Doctor. I don't know if you allow her to just take that last question.
Okay, let her take that while I get across to
okay.
the ES.
Yeah. So I guess is the question, the pains the new mother go through is serious. How do we handle it? Do we mean labor pain?
I think I'm talking about postnatal pains, maybe after Agaro and some other things like they call it.
Okay.
Is getting back to form and things like that. Just like the way you answer the what things. That of the mother.
Okay. So for the postnatal pain, there are several things that I can say go on in the uterus after birth. So you don't expect a uterus that has undergone 9 months of transformation to just go back to normal like that. That is why they say the first 6 weeks postpartum is very critical in the life of the mother. And at that time, she needs the support. She needs support as much as possible from family and friends around. So what actually happens is that the uterus grows so big towards term, and this uterus has to go back to the size of a fist. I hope we are getting what I'm saying. The uterus has to go back to the size of the size of a fist. I don't know how to explain that in Yoruba. The uterus has to go back to that size. So, and for the uterus to go back to that size, it means that so many of the muscles that might have been built up to accommodate the baby, all those muscles will have to, I would say, degenerate, or let me use the word decompose that is common to everybody, decompose, ogudo jera. So, toba de majera, yeah, those are what the mother releases out as this flow, the discharge after birth. And what has been proven to help the uterus go back to shape is breastfeeding. So it is expected that as a woman breastfeeds, she will feel pain from contraction of the muscles of the uterus, which is very normal. So the only thing that we can do is pain meds and some massages, maybe some cool massage or whatever that she might feel comforting. For our mothers, our yawa, I'm sorry to say this, so I'm sure that some of our mothers will be listening. But sincerely, using hot water to massage the tummy after birth is real punishment for the woman. It might give some form of relief though, but it doesn't actually do so much. If you massage, fine. If you do not massage, the uterus still go back to its shape. But what helps it most is breastfeeding. And with breastfeeding, the process is always very faster. The uterus go back to normal shape and the tummy flattens off. So all the mother needs is support, enough rest, and pain meds if the pain is that severe. Does that, I hope that answers your question, sir.
Okay. Hello. Oh, yeah, I think that was detailed enough to answer his question. Alaji Ejigbo. Hello, Alaji. I think he's also offline now. Now, hello. Assalamu alaikum.
Wa alaikum assalam rahmatullah.
I think he's also offline. So, yes, sir. Just got across to him now. The yes. Hello. Hello. Okay, I think the ES2 is also. I asked Sister Latifa raising her hand for some time now. Please, do you still have something to say? I've asked her to unmute. Hello. Okay, in the absence of the ES, and I cannot as well get in touch with Alaji Ejigbo.
I'm right here. I'm right here.
Okay, are you okay? All right, then please. I've been trying to get across to the ES.
Yes, it's online. Surprisingly, I don't know why.
I don't know why he's not coming on. I've also sent him. Okay, so Alaji Ejigbo, do I just
Amir in house? Can he give us the closing remarks, please?
He also just stepped out now.
Okay, Umu, please go ahead. You can end the session, inshallah.
Okay, Alhamdulillah Rabbil Alamin. We appreciate our lecturer for today. May Allah subhanahu wa ta'ala continue to increase you in knowledge. And she has been able to take us through chronic diseases. She has listed to us things women should watch out for. Very chronic diseases like the breast cancer, the cervical cancer, and the fibroid are key things she noted in her talk. And to the male, she laid emphasis on the prostate gland, and which someone made us know the Yoruba is Iseto. So alhamdulillah for the lectures, and the questions they answered also shed light on a whole lot, ranging from the topic of discourse today, and then she also dealt with some other questions that came from our audience that are based on also health issues regarding to kids, regarding to the family generally. We pray Allah subhanahu wa ta'ala continue to increase you in knowledge. May Allah subhanahu wa ta'ala bless you more and also extend his favor to all our audience. We have a it's an opportunity that we have had today, and we pray Allah use this as an uja for us on the day of Qiyamah and not an uja against us. Amen. So inshallah, I want us to recite Suratul Ikhlas for our noble Sheikh. May Allah subhanahu wa ta'ala continue to bless him and all our dead, and all the dead, and all our dead. May Allah accept them all to Jannah. Amen. Bismillah, Suratul Ikhlas. As Carol Group, Mr. Oladipupo, please kindly help us and lead the recitation. Bismillah, Suratul Ikhlas for the Sheikh, please. Hello. Bismillah Rahman Rahim.
Ahad, Allahu Samad, Lam Yalid wa Lam Yulad, wa Lam yakun lahu kufuwan ahad. Bismillahir Rahmanir Rahim. Qul huwa Allahu ahad, Allahu Samad, Lam Yalid wa Lam Yulad, wa Lam yakun lahu kufuwan ahad. Bismillahir Rahmanir Rahim. Qul huwa Allahu Samad, Lam Yalid wa Lam Yulad, wa Lam yakun lahu kufuwan ahad. Subhana rabbika rabbil izzati amma yasifun, wassalamun ala al-mursalin, walhamdulillahi rabbil alamin. Sallu ala man la nabi.
Sallu ala nabi.
Sallallahu alayhi wa sallam.
Sallallahu alayhi wa sallam. Now, inshallah, on the 20th of June, the Rois will be having a session through via Zoom, and it's a program the Women's Wing has brought. We'll be bringing up 20th June, inshallah. It's a Saturday, and it is going to focus widowhood, the grief, the healing, and the pain. The grief, the healing, and full recovery on widowhood, inshallah. The Rois will be handling the session, inshallah. We pray Allah subhanahu wa ta'ala spare our lives till then and beyond. Amen. So with this, we end the program for today. May Allah subhanahu wa ta'ala see us till the next. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh. Thank you very much, Doctor. We really appreciate you. Thank you very much.
You're welcome.
Assalam.